All right, it's 10. So I think let's not punish the prompt.
Yeah.
Well, welcome everyone. This is part 3 of our PHIPA series. And sorry, I just clicked a couple things there. This one is called Preparing for the Worst, and it's going to be a PIPA breach tabletop. So we're going to try and be even more applicable we have a couple scenarios to run through. John is our system admin at Brock IT. He has a passion for security. And so he has great expertise that he'll be sharing with us. I will be the moderator today, as I have been. And so you might actually hear me a little bit more, so I apologize for that as well. We do have some scenarios that we'll be working through. Some of it is kind of scripted for us, so I apologize. We will not be winning any Academy Awards today. So we'll try not to sound too robotic with it as we work through this stuff, but hopefully it is going to be very useful and with some hands-on information. So we will do each scenario and then we'll have questions after. And so please do pop in. It will be far more useful if you guys do help us and refine things, because there's things we may assume you know, and we'd love to be able to elaborate on those. So John, you might as well get us started.
Perfect. So jumping in, so there's the same process we use for all three scenarios. We picked out three common scenarios that you should be seeing in the industry. And this is the same process. So you're always reporting to the privacy officer in your organization. So if you don't have that person designated, then you need to. That is required. The next step is getting a log started. So all breaches, whether you believe that it's important or not, needs to be put into an official breach log. It can be as simple as an Excel document and just have like a different line for each one. And then you update that as the investigation progresses. And then, of course, the next one would be the investigation itself. And the investigation really is going to be following all investigations the way you would do any investigation. So who, what, when, where, how, and why. That's you need to be answering all of those as part of your investigation. And then you're going to be using that investigation to inform a creation of a report. So the report, there's really two different reports that you're going to be creating. One is internal use only, and that's, you're identifying what went wrong, how to prevent it going forward, what discipline is going to be implemented, if any, on staff. And then the second type of report is the external use. So this is something that's provided to the IPC or third parties, like a breach disclosure. And of course, those should be written by legal counsel just to make sure you're not accidentally admitting to some awful crime. Um, and then the last step is the notification process, and that's where you're actually sending that notification. And like I said, that notification needs to be written by legal, but on top of that, it needs to be written according to the legislation. And the legislation kind of frustrates legal counsel, I believe, because it says that the language must be clear, compassionate, and accessible. Three things that legal documents typically are not. So that's usually entertaining for them. So yeah, so that's the basic process, and we're ready to jump into the first scenario.
Cool. So our first scenario is basically a staff with no real role with care of the um, uh, resident is accessing them. So in this case, nurse accesses the chart of a former resident who was a local celebrity. The nurse had no care duties related to the resident, and so kind of where should we go with that? What's the first thing we should be asking ourselves?
Right. So, first step is kind of understanding how is the breach detected, because we've established you're already looking at something you shouldn't be. That's a breach. So we're going to be starting this process now. So, how is it detected? Was it through like a regular audit, or was it a tip off from a staff member that it's in real time? Um, and then we'll go from there.
Okay. So for this scenario, we'll say it was located via, or it was found via a regular audit from the EMR logs. So in this case, let's say, who would be reviewing the logs?
So in most organizations, so thinking specifically long-term care homes as an example, it would be your quality assurance nurse. They're usually the ones that are reviewing those kinds of logs anyway, just not necessarily for privacy reasons, but for other reasons. So quality of care, obviously, and that's usually who would be finding it. Now, that being said, um, there should be underneath your privacy officer, either the privacy officer themselves, which usually isn't going to be the case, but it's either the privacy officer themselves or somebody that they have delegated to be reviewing the logs for this purpose, for privacy purpose. We're looking to see, is Will looking at something he shouldn't be, and things like that. So we're trying to flag those things. So in the case of a manual audit, it means that we're looking at stale data. So, even if you review your logs once a week, which I would guarantee nobody does, um, then you're looking at week-old data potentially. And since most people review their logs monthly or even quarterly, if at all, you're looking at probably a month-old data. So it doesn't need to be actioned right this moment, but it does need to be actioned. So if it were a live alert, however, like if you had a SIEM product, so a security information and monitoring tool, then what you would have is an automated alert that comes up and alerts the privacy officer or their team that Will is accessing something that he shouldn't be, right? And in that case, the immediate step is disable the account. If it's stale data, then I would reach out to the staff member first to see if there is a legitimate reason that they were doing it, or it's possible that it's a breached account, and then you do need to disable the account as well. But if you can't access that person to ask them the question immediately, then I would be disabling the account. That would be the first step.
Okay.
So I guess now the next question would be like, what kind of information is actually being accessed here to figure out the severity of this?
So in this case, we'll say mental health notes, medication, diagnosis history. So all very highly sensitive information. So
Yeah,
where do we go from there?
right. So following our original process that we laid out at the beginning, we need to report to the privacy officer, and then the privacy officer is going to be um, starting an entry in the breach log. So they're going to create the entry in let's say their Excel document, and it'll have date, time, who reported it, how they reported it, which should always be in writing. Via email is often the best way. Um, just it's a nice CYA for staff to make sure that if there is ever a a question as to whether or not they reported something that they were supposed to report, they can prove that they have, right? Um, and then the next step is starting the investigation.
So my question is, as your privacy officers will be the ones that are filing the report initially, would it be standard for them to have a document like a template report for this type of thing? Is that something that is standard procedure?
It's pretty common to have a templated report that, your legal counsel has said like this is reasonable. You can fill it in this kind of information, and this is fine. That way, you don't need to keep asking them and then racking up bills because it will get expensive. Um, but really, like from the first step, you're going to have your log, which is going to be templated, and you'll have columns for all your different information, and you'll be following that basically. It's trying to figure out who did it, when they did it, what they accessed, um, how they accessed it, and going from there. So the first question is who accessed the file specifically, and in this situation it's a nurse accessing a former resident, right? So we've got who of both situations, who accessed it and who was accessed. The next step would be what data was accessed. Well, we figured that out. That's the mental health notes, medication, and the diagnosis history, right? So then the next step is when was it accessed and how many times, right? So was this a, one time they opened a chart, or was this they opened the chart and then they went browsing through the chart, right? Your logs should show all those things. So um, you're going to be looking at that. And then the other question is, was this a one-time occurrence? Or did this user now start bouncing around between different charts of people that they're not supporting in a medical capacity, right? So then once you have that, now we're saying, okay, where was it accessed from? Was this on their home computer? Was it a secured location? Was it a work computer? Was it, like at the local library? And that will raise all kinds of other questions, right? So if it's a local library, why do they even have access remotely? Like they shouldn't. There's no reason to. Um, and then, like I say, how? So how, local library, personal computer, work computer, whatever, and why? Is there is the staff member giving a legitimate reason? Is there no reason at all? Are you even able to talk to the staff member? Maybe it's a past staff member. So things like that all need to be answered as part of the investigation.
So in this case, we'll assume it was unauthorized. So when at that point, when would you be notifying the powers that be? When would that process happen?
So in this particular scenario, it's a nurse. So you're going to have to be sending a notice to the College of Nurses because they're going to implement disciplinary action. But on top of that, you have to report it to the IPC, and you have to be reporting it to the family. From the sounds of it, this is all past tense. So a nurse accesses the chart of a former resident. Former is usually for a good reason. And there's also the word was. So I'm assuming this person has passed away, and you're going to be reporting to the family. If the person hasn't passed away, you're going to be reporting to the person directly, unless there's like a power of attorney or something like that. Um, so you have to report to the person or family, POA, the IPC, and in this case, College of Nurses, because this is something that is against the code of conduct for the College of Nurses.
Okay. Okay, so once that has been done, legal counsel has advised, we've reported to the powers that be, um, looking to mend this and prevent in the future. What can be done from an organization standpoint to limit this or um, prevent it?
Right. So I think this is a pretty common problem with EMR software where it's a they just seem to have this expectation that a nurse is a professional and therefore can be trusted. And I have kind of the opposing, not that I don't trust nurses, but that I don't trust anybody, right? You don't give somebody keys to the whole kingdom and just say, well, I trust them. You have to be limiting each person's access to only what they need to function in their role. So the best example would be, let's say you have a long-term care facility with 3 floors. If a nurse only ever works on the third floor, then you should only give them access to patients that are on the third floor. There's no reason that they need to be able to access first and second floor residents. So that's an example. Now, obviously, there's situations where a nurse floats around and whatever. Um, and your EMR provider should be able to articulate a solution in that situation. Um, a good example of this helped a client recently. They're switching from to a new software provider, and always those are a toss up with us when we're talking to these new providers because 50% of the time they're just awful. 20% of the time there's very little in the way of security. And then maybe if you're lucky, 30% of the time there's an actual valuable conversation. And in this one, it was great because when I asked, how do you limit the permissions? They had said, well, each nurse only has access to the patients that they're going to be reviewing within plus or minus X amount of days, right? In this case, it was a home care uh, organization. So, that's a great example of a way to limit that. If you know that that nurse is going to be, let's say in the case of a long-term care facility, on floor one for, Monday, Tuesday, Wednesday, then there should be a mechanism in the software to limit them to floor one, Monday, Tuesday, Wednesday, and then give them access to floor two if they're working on floor two on Thursday and Friday, right? You need to be limiting permission. Um, and then, of course, the next step would be having an acceptable use policy that's very strong, right? Because if if you don't tell somebody that something explicitly is not allowed, they're going to assume that it is allowed, right? So, although the College of Nurses explicitly says that that's not allowed, your organization should be doing it too. Unfortunately, it's the reality of the world we live in that you have to say it twice. Um, and then, of course, regular training. So the training needs to be applicable to this particular topic. There's no reason for Will to be looking at somebody else's chart if he's not, supporting that patient medically, right? So that would be the next steps.
Awesome. All right. Is there any questions regarding scenario number one? The question Q&A button at the top should be there. You can definitely log it in there. Um, and we're happy to address any questions there are. My big recommendation from all of this is just to make sure that, for our clients, one of the things we provide is a DR plan, so a disaster recovery plan. And what that does is it just removes the thinking necessary when and if a disaster happens for our client. We can just refer to it, and essentially you're just following the steps. You're banging out, this, then this, then this, then this. And so in the event of an emergency or in the event of a breach, you want to make sure that you're not having to make very complicated decisions and figure things out logically, because there's a chance there'll be some emotion involved, which will hinder that. So having these things outlined, having templates for your reports, all of that can be done ahead of time with a rational mind, and with legal advice. And then if something happens, you won't really have to rely on that part of it, and you can just follow the system that you've created. So that would be my biggest kind of application for people going forward with this, is just to really make sure they've got that stuff nailed out. Um, Also, a lawyer is not going to charge you quite as much if you don't call them in a panic on, a Friday afternoon of a long weekend with a breach. And if you if you can get them at a better time, that's probably going to be a good thing for you.
Yeah,
Okay,
exactly. All right.
I guess we'll go on to situation two, scenario two. Okay, so this one is a stolen work laptop from an employee's vehicle. So a care coordinator's unencrypted laptop is stolen from their car. It contains spreadsheets with residents' data. So what would be our first concern going into that once we
so,
find out?
you know, the first question, I guess, is whether or not it's encrypted, and if not, then yes, this is a um, high risk device, right? So it says in the summary that it's unencrypted. So for me, that's high risk. But even if it is encrypted, it still needs to be logged. So that breach log for the privacy officer, they still need to be logging it, even if it's not unencrypted,
Can
right?
you, I think it's possible that not everyone understands, like we understand maybe encryption, but could you just what the tangibles would mean? So if someone stole that device and it was encrypted, what does that mean versus it not being encrypted for the person who stole it? How would that work for them?
Right. So no encryption is kind of perfect. There are better encryption methods, obviously, but no encryption is perfect. So really, what you're doing is you're keeping honest people honest. If somebody really wants into that laptop and really wants that data, it's obviously something that can be done. But typically, something like a stolen laptop from a healthcare facility is not corporate espionage. It's somebody seeing a laptop that they can sell to a pawn shop, and that's what they're doing. So in this case, because it's encrypted, it means that the data is scrambled, which means nobody can get into it and get that data and potentially cause a significant breach, right? Whereas if it's unencrypted, then anybody with physical access to that device can watch a YouTube video and get into that device. Like laptops are not secure devices. Even servers are not secure. If I have physical access to it, I can get into it with a 5 minute YouTube video and a USB key. So it's really important to keep everything encrypted and to take it very seriously if something isn't encrypted.
So how would you verify that it was encrypted once you find out the device is stolen?
Right. So every company should be using an asset management tool of some kind. If you're a heavy Active Directory company where you've got Microsoft Active Directory because you're a large company, it will show in there. Um, you can create a module basically that will force encryption on all devices and then report on devices that aren't. Um, but for us, I find even more effective is using an RMM tool, which is a remote monitoring and maintenance tool. Um, so that there will report immediately if a device doesn't have encryption enabled, and I can pull a report and say, these are all the devices. And that one that was just stolen was checked in 15 minutes ago and it was encrypted. So we're good, right? Um, you can keep a paper copy, but a paper copy is outdated the moment the ink is dry, right? So I don't trust any kind of copy of data. Like if I don't have a tool that's specifically saying I checked in 5 minutes ago and confirmed the device is encrypted, I'm going to assume that the device is unencrypted. And you should all assume that because if you just have a piece of paper that says it is, then 5 minutes after that paper was written, it might have been decrypted, right? And disabled. So
Okay. Um, so then what's the protocol when a device is stolen?
So, per usual, we're following our violation process. So the first step, report to the privacy officer. Second step, privacy officer has to start a um, a record of it in their breach log. And in this case, because there's stolen hardware, we need to report to the police as well. So um, then, of course, we do our investigation as far as, because the police aren't going to care like what data is stolen. They care about the physical hardware, right? We care about the data that's stored. So we're going to research to find out anybody who's affected by this, and anybody who is affected needs to be reported to. So that's the IPC for sure, and any resident whose names were involved, healthcare numbers, medical histories, anything like that, that all needs to be recorded, and then individual notifications need to be sent out.
And is there anything else we need to do before any notifications?
Per usual, make sure your legal team is reviewing those notifications, or ideally writing them. Because like I say, there's a huge amount of liability to admitting to something. So you want to make sure that your legal counsel is involved in that. Otherwise, they're going to be very upset when they have to clean up your mess after.
Right.
So,
Okay. Would that device meet our asset management standards?
no, for sure not. Like the reality is that every device, whether it's a healthcare provider or not, should have encryption enabled. So if somebody steals a laptop, whatever, they stole a laptop, you're out $2,000, move on, right? Um, but if there's no encryption, then you're out $2,000 plus at risk for fines because of loss of data. You're at risk of reputational damage, etc. So there's all kinds of implications there. So that's why it's really important that you have a standard in place, and you make sure that all devices are complying to that standard. So in this case, the standard would be that encryption is enabled.
And really, unless cases are, specific, basically not trying to bring devices off of the lot and out
Yeah.
of the building.
Yeah, I mean that falls under your work from home policy or acceptable use policy. There's various different policies this could fall under, where anybody who's taking a laptop home should be with the understanding that laptops shouldn't be in full view. They shouldn't be staying in your car overnight. You should be going directly home, taking it out of your car, and bringing it into your home. Your car is not a secure place, so you need to be aware of that and taking the device out and keeping it in the home where it is more secure.
Cool. All right. Is there any questions within that scenario?
Nope. Looks like quiet.
Crickets. Excellent. All right. So, scenario number 3. So this one is a box of historical resident charts. So data from that is found outdoor in a recycling bin, not locked, not shredded. What's the issue there?
Right. So, the big issue here is that you've got healthcare information that is not being disposed of properly according to PHIPA's standards. So PHIPA specifically talks about how to dispose of records. So physical records should be shredded. Digital records, you need to have a process that makes sure that it's unrecoverable. So really, the disposal process in the case of physical resident charts is it should be going into a shredder first, or one of those shredding bins where there's a service, a company comes by, picks it up, and certifies that it's being destroyed.
Um, so what should we ask first? What should we be doing first?
Right. So the first question I have immediately is, what's our disposal process? Do we have a policy in place on how, medical documents are going to be disposed of? Is there um, is there a process in place already? And how is that being reviewed and audited and ensured that people are actually following it? Right.
Right. Yeah, because is it clearly defined? Is it being followed?
Yeah.
Yeah. Is it not there at all? Yeah, and how are staff even trained on it? You know, it's great if it's a policy and it's bulletproof, but if it if the staff aren't aware of it and trained and reminded, then yeah, that's not very helpful either.
Yeah, exactly. So it needs to emphasize specifically the disposal methods, right? So you need to be saying specifically in the policy that paper documents are to be shredded or dealt with via a shredding provider. These are the available locations for the shredding boxes, etc. You need to be making it as detailed as possible because, to Will alluded to before, is that there's a situation where, sometimes we're so busy doing our day-to-day tasks that we're not thinking, and having it be a reflex of just making sure that documents like that go into a shredder is is extremely important, right?
Okay. So who would audit these procedures and policies for that matter?
So, typically a an employee policy would be kind of audited and reviewed by the HR. However, in the case of privacy, really it should be the privacy officer making sure that they're auditing as well. So you've got your own HR audits that are happening just to make sure that you're compliant from an HR standpoint. Um, but also auditing your privacy officer should be auditing from that standpoint. And then, often the privacy officer is delegating a lot of these tasks to like a quality assurance nurse, as an example. So they might be the ones auditing as well. So with a policy like this, there's a lot of overlapping of responsibilities. But when it comes to PIPA, the person that's ultimately responsible is the privacy officer. So they need to be having not just a policy of this, like that we're going to be having this shredding, but a policy in place that they are going to review said policies on X interval, right? And then documentation that they're doing that. And, as frustrating as that is for people, that you have to have policies related to policies related to policies, etc. It's just a requirement, right? We have to make sure that we're protecting ourselves and removing the thinking because humans make mistakes, right? So documenting the actual process and just following that process every time so that way we're not missing things.
Right. Okay, so then in that case, let's assume if the breach is confirmed that that was, there was information about people's health in those documents that were found, what would happen next? What should be going on?
Yeah, so I mean, in this case, we've got a physical box, right? And what you'd want to do is best case scenario, you have cameras in your building and you can see somebody carry the box, put it by the trash bin, and it never goes out of camera sight. And you see the trash bin and you see nobody access it. So we can confirm there was no breach. It should still be in a log that you investigated this, right? So like your IPC log that your privacy officer is dealing with should still be in there, and you should still be saying like confirm nobody accessed it, blah blah blah. If it's just that and it says that, then you don't need to be reporting to the IPC other than your annual like, audit log report. But you don't need a specific log for this failure. You just need to correct it and make sure that there's corrective action on file and you know what you're going to be doing going forward. However, if there's at any point where that box is sitting somewhere unattended and it doesn't have camera coverage or whatever, it's unattended, then you have to assume that it has been breached, that data has been copied, data has been looked at, whatever. There's, if you don't know, then assume it happened, right? And now you need to go through that box and say, all right, so Will and Jonathan and, Tracy and whoever all have medical files in this box. All of them need to be notified that this is what happened. This is where we discovered it. This is how we discovered it. This is what we're going to be doing to make sure it doesn't happen again, etc. Um, all that notification needs to be done, but you need to walk into those types of situations with information. You can't just show up and say, there was a box. I don't know what happened. We don't
What's
know
in
what
the
we're gonna
box?
do. Yeah, like, sorry. So
Okay. So then that comes down to having the policy in place. Um,
yeah,
and so for prevention, we kind of talked about that already with training, having policies that staff are familiarized with, making the system easy for people to get rid of documents appropriately, so that not the path of least resistance is not the wrong path, but it's very easily accessible for people to do the right thing.
yeah.
Um, is there anything else with that as far as physical breaches, like um, that we should be aware of, or that you can prevent, um, systemized that way?
Yeah, I mean, it's like you said, you kind of touched on it, that there's you need to kind of sometimes take away that thinking. If people are trained and you're following the psychology of the person, right? Like, you have to understand from a security perspective, it's the same thing. Like, when I'm securing, systems, I'm looking at path of least resistance. And if you make all the less secure methods just painful to do, then users are going to avoid those methods because they're painful, right? Um, I kind of joke that you can leave a door unlocked as long as the floor in front of it is just all razor blades, right? It, but it's easier to just put a lock on the door, right? So in this case, we kind of want to make sure that there's no physical way. Like, if you see somebody walking out with a banker's box full of papers, that, hey, maybe we should take a look at that and have two people just make sure that there's nothing sensitive in there. Um, or just have a policy that every single piece of paper in your organization gets shredded. That's also an option. So every organization is different. Your appetite for frustrating users is different in every organization, because you have to remember that any change you make and any process you put in is going to frustrate users. So you need to be prepared for that, and you need to understand what the level of frustration that you're willing to put your users through is. Like, how far are we willing to take this?
Yep. And yeah, and part of that comes down to, again, talking to your legal counsel and getting an idea of um, what you should be doing, and also just looking at it from a common sense standpoint, I think is often
Mhm.
a great option, just to kind of look at it from 10,000 feet and say, like, how can we make this easier for our staff and for them to do the right thing and to know what to do, um,
Yeah.
and kind of
The other
address it.
thing, just, we've talked about what the resolution process is for these three scenarios. Like, what are we going to do going forward to make sure this doesn't happen again? And the thing is that a lot of the organizations have quality assurance nurses, and those are seriously good resources. They're thinking from a quality standpoint at all times. And I would argue that privacy falls under quality of care, right? Because if I'm a resident and then I'm told that, my information is being sold somewhere, um, I'm going to consider that a pretty low quality organization to be housing me, right? So that's something to be considering because they're typically anyway, they're going to be trained in quality assurance best practices. So, for example, in manufacturing, there's the five whys, right? And the idea is anytime there's a failure like any of these that we've discussed, they're going to say, why did this happen? And then when someone gives an answer, you say, why? And then, so that's your second why. And then someone gives an answer again, and then you say, why? That's your third. So you're going to do that 5 times. And the idea is you get down to the root cause. And often it was easier for somebody to do it this way, and they're just trying to get their job done, and they're trying to do things quickly and easily and blah blah blah, right? So a common one with just going back to scenario one here, a nurse accesses the chart of a former resident. Well, unfortunately, a lot of organizations aren't using single sign-on, which means nurses have 20 different logins and they're trying to get their work done. So they end up writing their password down or they end up using the same password multiple times. So, we approached this from the idea that the nurse who our log says access this is the person who did it. But in reality, if they're sharing an account or they're sharing a password across multiple accounts and somebody happens to know that password, there's a pretty good chance that if somebody wanted to cover their tracks, they could log into one nurse's account and be a different person. Um, so Will could sign into my account as an example if I didn't have a good password on it, um, and that's going to happen when you have a nurse with 10 different passwords that they have to remember. That's inevitable. They're going to use terrible passwords. So you need to make the path of least resistance be the most secure, right? So in that case, we can solve and make sure that the nurse that did this, according to the logs, did actually do it by using single sign-on. Because then there's one account, one password, multi-factor authentication. We know for sure that's the person who did it, right? So,
which streamlines that whole investigation process because you can, pretty much eliminate so many variables in the scenario where you can kind of say, yeah, no, this did happen. And so again,
yeah.
that's and part of it is just being integrated within your IT, and so that your privacy officer is dealing um, with your team and your IT, and they're working together on how to streamline that. Because I always say there's kind of a two sides of the spectrum. There's convenience and there's security, and they're not often together. And so for each organization, you have to find the balance of you're not pulling your hair out every time you do something, but you're also not, uh, you know, being diligent in security in the methods that you're using. So there is a balance. Single sign-on is one of those things. For those of you who don't know, it's basically where you'll choose one account, and that's kind of the truth. That's the way that you can verify you are you, and then you're able to use that method, which in most cases is something like Microsoft 365, uh, to authenticate the rest. So instead of having a separate account for each other login, you're going to authenticate through that one account, which, for example, let's say is 365, and so then it eliminates, many different passwords. And so then the idea being that you would be able to have one that's an actual secure password because you don't have to remember 15 passwords. And so that's kind
Yeah.
of the convenience side of it. And so that's something you can work with your IT team and try and find a balance in that. But again, these nurses are doing an incredible amount of things, and so making their life simpler when you can is definitely the best option. You just have to find that balance where you're not oversimplification in the sense of compromised security. So,
Yeah.
um, is there any other questions? We kind of finished up, I would say, well, pretty much right on time, I guess. We were 53 minutes into this.
per last time, we'll get half a dozen emails at the end.
Yeah, so
So that's all right.
don't feel bad if there is questions after. We are happy to facilitate that way. I'm the account manager at Brock IT, so I'm happy to answer any questions I can and bring in John when I need to, which is fairly often. So yeah, definitely don't hesitate to reach out. Um, and again, in Teams, you should see this recording sent out. I'll be sending an email out to everyone with kind of the links to the recordings of all three of these. And we do have some paperwork, kind of handout notes as reference for that. If you do have any questions about this, we are happy to help. That's something John has uh, a passion for, is just making sure these things are dealt with appropriately and that people have armed with good information to make sure that they can make the best decision. So any questions at all about what we've covered today, or how it may pertain to your, don't hesitate to reach out. And I think that's all I've got. So if there isn't any other questions at the moment, we will send you on your way with 14 minutes in the bank. So um, that's gold. So I hope the rest of your week goes well. And from all of us at Brock IT, have a good one.
Awesome.
Yep. Bye, guys.
Bye.